Assalamu alaikum. So my name is Professor Dr. Ejaz Ullah Cheema. I'm currently working as Dean School of Pharmacy at University of Management and Technology. Prior to joining University of Management and Technology, I was working as Program Director for the 5-year MPharm program at the University of Birmingham from September 2018 till September 2021. I graduated from University of Punjab in the year 2002. I worked in a pharmaceutical industry in Islamabad for a year and then proceeded to the UK, where I pursued my Masters in Pharmaceutical Services and Medicines Control from University of Bradford and completed my Masters in 2004. Then did my Overseas Pharmacy Assessment Program, which was a diploma program from Aston University in the UK, and I also completed a year training with Boots, one of the largest retailers in the UK and across the world, as pre-registration training. I worked as a registered pharmacist and pharmacy manager for Boots for over 10 years in Birmingham in UK. I also completed my PhD from University of Warwick in the area of pharmacy practice in 2015, and here I am at the University of Management and Technology. Well, pharmacy profession, I would say, has been one of the top 3 choices in the healthcare profession as far as Pakistan context is concerned. It has been the one of the 3 top choices for the students. But the latest surge, or the recent surge in the popularity probably can be explained by the recent legislations which have been enforced by the Drug Regulatory Authority of Pakistan, which allows pharmacists to be one of the major contributors in the healthcare industry. For example, the legislation requires every pharmacy to have a pharmacist on premises. Secondly, pharmacists are now allowed to use the title doctor as part of their title. Also, as far as the hospital sector is concerned, the legislation requires that for every 20 hospital beds there should be a pharmacist, and that probably has sort of raised the employability rate of pharmacists across Pakistan. So this explains why there has been a surge lately in the popularity of pharmacists and in the pharmacy education. Well, there are a number of career opportunities for pharmacists in Pakistan. If you talk about the local pharmaceutical industry, which is one of the leading industries in Pakistan, which is not only catering for its local population but also exporting medications across the world, including the Middle East, including Africa, and pharmaceutical industries employs a significant pharmacy workforce. I would say probably more than 50% of pharmacists who are registered with the Pharmacy Council of Pakistan are working in the pharmaceutical industries, whether it's the production, whether it's the quality assurance, whether it's the procurement of medications, whether it's the quality assurance, quality control. Pharmacists are working in all these different departments across the pharmaceutical industries. Also in the research and development as far as the pharmaceutical industry is concerned. Secondly, if you talk about the hospital sector, as I mentioned previously, that the legislation requires pharmacists to be employed for every 20 hospital beds, and there are currently now new legislations which are in pipeline that proposes that pharmacists' presence must be ensured for every 10 hospital beds. Which also employs a significant workforce of pharmacists. Thirdly, about the retail sector, that pharmacy, each and every pharmacy which is operating in Pakistan requires pharmacists to be present on the premises. So again, retail pharmacy sector employs a significant workforce for pharmacists. Then pharmacists are working in the drug regulatory authorities, in the regulatory affairs. Fifthly, pharmacists are working in the marketing and the sales in the academia sector. So there are a number of career options for pharmacists. Abroad, pharmacists are currently working as a key player as far as the healthcare context is concerned. If you talk about the UK, pharmacists are not only at the front line of delivering patient care, but also now prescribing medications to patients. They are working in the primary care health centers, working alongside with the GPs, general practitioners, nurses, and prescribing medications which ranges from all different types of medications. So they are actually prescribing. Similarly, in the US, pharmacists are working and delivering a number of pharmacy services to patients, whether it be medication management services, whether there are hospital services, and similarly in Australia. So the role of pharmacists has evolved significantly over the last 2 decades, I would say, from the traditional role of dispensing of medications to patient-oriented services. As far as Pakistan is concerned, the impact or the global impact of the role of pharmacists or the change of role of pharmacists is beginning to make its impact in Pakistan also. As I mentioned previously, that in line with the new legislations which are being enforced and implemented and introduced by the Drug Regulatory Authority of Pakistan, are sort of mimicking that model which requires pharmacists to be involved in the delivery of patient-centered care. For example, the engagement of pharmacists in the hospital sector. For every 20 beds, as I mentioned, that there should be a pharmacist. Similarly, in the retail sector, pharmacists should be present in the pharmacies. So I'm optimistic about the engagement of pharmacists, or the wider engagement of pharmacists in the next 10 years or so, where pharmacists would be hoping to deliver much more patient-centered care actually, and playing a significant role in the delivery of patient care. The healthcare profession in particular in Pakistan and pharmacy seems to be a popular choice for the female graduates and female staff. The female staff are actively working in the healthcare profession, whether it's the hospitals, whether it's the pharmaceutical industries, whether it's the retail pharmacy outlets. And that gives a reassurance to the future female students that in Pakistan there is relatively safe working environment for female students and female graduates in different sectors I just mentioned in Pakistan. So given the safe working environment for our female students, I would encourage our female students to actively apply to the pharmacy program. Rest assured that you'll be looked after in our School of Pharmacy. Firstly, University of Management and Technology Lahore is one of the leading academic institutions in Pakistan in the private sector. It's a chartered university under the Government of Punjab. Also, it's recognized by the Higher Education Commission of Pakistan. As far as the School of Pharmacy is concerned, we have dedicated campus for the School of Pharmacy. We have very spacious and state-of-the-art and modern facilities, including our labs that are fully equipped with the modern equipment, also our classrooms, and we have over 2,000 books for the students. Secondly, we have a foreign qualified and experienced dean, supplemented with foreign qualified faculty. Thirdly, we offer a very affordable and competitive fee structure for the students. Fourthly, given the change in the role of pharmacists across the world, we are committed to providing quality education to our students, and hence in line with those changes, we are employing not only the traditional teaching methods in our School of Pharmacy, but also introducing new and innovative methods of teaching. For example, we would be employing problem-based learning in our pharmacy practice and clinical teaching. Also, we'll be employing simulation-based teaching. We have introduced for the first time in Pakistan as well as in the region, which is a virtual pharmacy teaching tool known as My Dispense, and our students would be using this tool across the 5-year program. Also, we will be introducing the interprofessional education, which is something bringing the different disciplines together and making them learn in a collaborative and conductive environment. Also, we have signed up collaborations with a number of pharmaceutical industries in Pakistan and in particular Lahore, also with certain leading hospitals in both in public sector as well as in private sector. Well, the primary role of pharmacists is to ensure that the patients receive not only safe medications, but effective medications. So it's the prime responsibility of pharmacists, based on their knowledge and expertise in the medicines, as well as their components. A pharmacist needs to advise patients how to take their medications. Firstly, making sure that it's not only safe, effective, but also they have the right education and guidance how to use these medications. So, for example, if the prescriber prescribes a medication to the patient, a pharmacist's responsibility is to ensure that firstly the medication is safe, both in terms of dosage and also the administration. So they can collaborate with the prescriber to ensure that the patient is receiving the right medication with the right dose. Similarly, when it comes to the non-drug treatment for patients, pharmacists can advise the patients about adopting a healthy lifestyle in accordance with their different ailments. For example, if it's the cardiovascular issues, the pharmacist can advise how to take their diet properly, also about adopting active and healthy lifestyle, exercise. Similarly, pharmacists can advise patients about taking certain vitamins and certain supplements. So all in all, it's an important role for pharmacists to ensure that patients receive quality, safe and effective medications. Well, Doctor of Pharmacy program is a 5-year focus program, and we at School of Pharmacy are very much committed in ensuring that our students maintain a strong focus on their studies while enjoying the campus life, and we very much look forward to welcoming our students at the School of Pharmacy. Thank you.